Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. It's good. It's on now.
Good morning.
Sorry. Dr.
Good
Mencia.
morning.
You're
Good morning,
as beautiful
Anita.
as ever, and now we have Ina here too. Ina. Hello, Ina.
I said beautiful. I had to pose.
And I'm going to do a little something different here because you have a guest.
We have a
Very
guest.
beautiful woman here.
Yes.
And who is she?
This is Pamela Shenk. She had been with us. Good morning, Pam.
Good
Hi,
morning.
Pamela.
How are you? Hi, everyone.
Pamela and I
Okay,
have
we're
been
coming
working
back to
together
you.
now for some years. And she's a clinical hypnotherapist. So we're going to talk about hypnosis.
Well,
and the
before we
importance-
do that, can a
let's talk about the
clinical-
flu.
That's what I want to say. Can a clinical hypnotist get rid of the flu?
Well, you know something, this is a good point. It's a great point. Being a Taekwondo grandmaster and teaching meditation, and from my own experience, the brain is called mind over matter. So a person can have the beginning of the flu, and they go right back to bed, and they will get really sick. All a person, sometimes you might get the beginning of the flu, you start drinking a lot of fluid, you overcome mentally and allow your immune system to fight the flu. And those people will need less medication and will overcome the flu much faster. So I don't know what Pam takes is on the hypnotherapy and something like the flu, but I think there could be a lot of positive input from hypnotherapy on something like the flu.
So it won't get rid of the flu, you're saying, but it may alleviate the symptoms. But the one thing we do have to mention, Dr. Mencia, is go get your flu shots.
Absolutely, absolutely.
Okay.
And we got ours, so we're good.
Yeah, that you always make me do that. We always do it. Okay, so Pamela, what do you think?
Well, I have a saying, what the mind believes, the body achieves, real or imagined. It doesn't know the difference between truth and fiction. So you know your body really well, and when you feel it coming on, become proactive rather than thinking, oh my gosh, if you think negatively, you're going to have negative results. If you think positively, you'll have positive results. If you, that very first day, like Dr. Mencia said, start drinking those fluids. If you need to, stay in bed for one day, and you, well, I can't diagnose for anyone, but often you'll feel better the next day. It's catch it right away.
Right, it's mind over matter.
And by all means, don't go to work and share it with everyone if you do get it and think, oh, I have to go to work, because it is an epidemic.
And so, Pamela, you are there at the AGI Institute with Dr. Mencia and all his wonderful colleagues?
Yes, I am.
So, Dr. Mencia, where do you always find these incredible people who you love to have all these great people around you, don't you?
Yeah, well, my dream is to build a network of professionals that when it comes to healthcare, and, you know, like Pamela is independent provider on clinical hypnotherapy. I'm an independent provider in internal medicine as a clinician and as a geriatrician.
But you're the founder.
But I'm the founder of the dream, of the idea. Yeah. So as I come together with good people that can work as a team, because lots of time Pamela and I will be working on a patient, let's say, with pain, and the person want to come off from pain medication. So we offer them the services of Pamela to come in, and they will sit down, and it's all a matter of the willingness of the individual. I tell you, and I fell in love with Pamela once when I had one of a good friend of mine who is my patient and the wife, and the wife's telling me, I want my husband to stop smoking. And I said, well, we can do medication. You can do, and he said, I don't take any drug. I don't want anything but the smoking. That's his drug. And the wife say, I will pay for hypnotherapy if you think that will work. I say, sometimes one shot. You go for one treatment, and you can quit smoking. And he goes, okay, I will give it a shot. So she paid for him. He went up to see Pamela in the office, and when they are sitting in the room, the first thing she asked, why are you here? My wife want me to quit smoking. And she asked
wrong
him.
answer.
And I didn't hear this
right.
from her. I hear this from the patient. And she said, well, what about you? Do you want to quit? I said, no, really, I'm just doing it to please my wife. And she said, go downstairs and take your money back. We won't take your money because this is going to be a waste of money. And, that's honesty.
And what happened?
He went back down.
left.
He left. He still smokes.
He wasn't ready. There was no point.
Exactly.
But it's a story both of us have told so many times.
So many times. It's how it is. If you want something, you want to lose weight. We have one doctor that used to pull out her hair. And it's a psychological condition. And she's a doctor, a beautiful girl. And she used to pull out all her hair, her eyelashes, her eyebrow, whatever she would find hair. And when she wouldn't find no hair, then she would pull out her, the hair from the skull. And I told her, I said, you need to go and see Pamela, because for that condition in medicine, in psychiatry, there's no treatment. The only treatment that have worked in most people is hypnotherapy. Otherwise, there's nothing out there. And she went one time. And today she's practicing in a blooming practice, doing well, and she quit with one treatment.
So let me talk to you about this, Pamela. I have a few questions. Why did you become a hypnotist? What made you do that?
I've always been involved with the mind-body connection in wellness.
It's her eyes.
Yes, she has beautiful eyes.
And it's a passion for me. It truly, truly is. I wish I had discovered this in my 20s. I mean, I just love it because you can help so many people. And often medication is necessary. But I think all too often we say, give me a pill, I need a pill for this, I need a pill for that. Medication has side effects. Holistic has side benefits.
Now, something you said when I first asked you about being a clinical hypnotist, you said, I'm clinical, I'm not a stage hypnotist. Why don't you explain what you mean?
Well, there's so many misconceptions in the world about hypnosis. Stage hypnosis is real, but people think that you're asleep, you're unconscious, it's a truth serum, and nothing could be further from the truth. You cannot make anyone do anything they don't want to do, but there's only two reasons someone can't be hypnotized. They don't want to be, or there's an underlying fear. But if I said to someone in my office, you're going to cluck like a chicken, they're going to go, no, I'm not. I mean, that just doesn't happen. At least so far, no one's come in wanting to cluck like a chicken.
And we talked a little bit about meditation. Dr. Mencia, you have been meditation is so important to you.
Oh, meditation is something I practice every day. And I've been doing it for so many years. And, when you do meditation, is like any other exercise in life. If you do it frequently enough, you will master the condition. So you can go jogging once in a blue moon, or you can go jogging every day. And so the more repetition on anything in life, then the more you get to master that. So, to me, meditation is so important when you're going to brainstorm about certain condition that you want to fix in your life, in your business. You go into meditation, you prepare your mind, your environment, your resources. And when you go into meditation and you think, well, I need to fix this in my office. When you go into meditation, you'll bring resources into, your conscious that you will not have thought of. You might have overlooked them. So, and meditation also is very important to bring down your blood pressure, to bring down your heart rate. So when your blood pressure is low, your heart rate is down, you have less chance of having complication of the stress of life.
So you've seen Pamela Shenk. Let me just say that again, Shenk. And Pamela is someone that works in your office. So if someone is looking for a hypnotist, a clinical hypnotist, I suggest they go and do it through you, because this is a medical situation. It isn't like stopping. You see some of these places that, as you're driving along, it says, psychic and all this. Right. We don't want to do that.
And Pamela, like any other of the other providers, we are not a all or nothing. This is, like I always say, it's a menu in a restaurant. You can bypass the appetizer and go straight for the main course, or just go straight for dessert. So if you just need Pamela, you can call and say, I just need to have an appointment with a hypnotherapist. And they will set everything up either at my office or at the other office where you work out.
So if someone, though, wants to go, I'm going to have them call your office, and then they can get more information. Okay, if you want to go see Dr. Mencia, first go and see him for a flu shot. Please go. I've had more people come up to me. They said, I've been in bed for 4 weeks. I said, 4 weeks? Yes, I had the flu. I said, how come you didn't get a flu shot? Well, I didn't believe it. I will next time. Yeah,
Not
right.
only they don't get a flu shot, they don't go and see the doctor sooner.
Yeah.
The sooner you go, if you're going to get Tamiflu, if you're going to do anything, the sooner you tackle the flu, the faster you're going to recuperate from it.
Right, and the less damage it's going to do to other organs, right?
Exactly.
So this is the phone number. Remember, this is Pencil Talk Radio, so it's 954-489-1345. 489-1345. That's the Fort Lauderdale office, and of course they now have a wonderful Boynton Beach office, actually with a hearing aid center right there in there. But they have nutritionists there. You have all sorts of other kinds of people. Right, services. Right, okay.
Mentor.
So the phone number there, you can call directly. It's 561-370-6494. But if you only have the one number, they'll help you. Now, remember, home visit services are available for homebound patients. The other thing I don't want to forget, Dr. Mencia.
After they see Pamela and they feel great, then they can go to Stonewater Med Spa.
I was just going to say that you may have to have her come over to Stonewater Med Spa, because there are people there, I'm sure, who can use a clinical hypnotist, right?
I agree, yes.
So have you been yet, Pamela? I'm coming over here to you. Remember, we're now on Facebook Live. This is really new for us, but having attractive people like you make it better. That's why Dr. Mencia always looks so gorgeous every Saturday morning. So do you think that when people come in to look beautiful, that they could have like one, even if they don't have a specific problem, wouldn't they feel better after you work on them? And
without a doubt, I have people that come in for stress relief, because it not only gets the body, it gets the mind.
Right, gets the mind to
Mind
think.
and body both get relaxed.
Oh, that's good.
It's kind of from the inside out, mentally and physically.
Okay, so
it's extremely relaxing.
So what's the first question that you ask when someone says, okay, what are you going to do for me?
Usually, I know before someone comes in what they're coming in for, because it's important, like the smoker, where I can say to them on the phone, are you coming in because you want to, or is someone forcing you to come? Oh, not forcing, but asking you to come in. And then I'll say it's best if you wait till you're ready. So I usually know ahead of time why someone's coming in. But it could be stress, pain management, fears, phobias, test anxiety.
Huh. You're right. No, hypnotism is very interesting. And I actually did take a course in energy, and I understand the Silver Mind Control course. I took that, and I understand what you do, and it's fabulous. So anybody that has some serious thoughts or complications, whether depression or someone has just lost a loved one, you could really help, couldn't you?
Absolutely. And if someone's going through an illness or about to have surgery, they're fearful. They can be the most positive person in the world. But that fear, sometimes people can't get out of their own way. And they're wanting to be positive, and hypnosis can get them not only through the surgery, but fully recovered. And also, if they're relaxed going in for surgery, it's a lot easier for the surgeon. And they'll also use less anesthesia, so they usually will not have that anesthesia fog after the procedure.
And
So,
can you
Dr.
can you
Mencia.
explain the difference, Pam, between the conscious and the subconscious when it comes to hypnosis?
Okay.
Moving back. Love
The
this.
simple answer between the conscious and the subconscious. Your conscious mind is your rational mind. It's the job of your conscious mind to give you a good reason for everything that you do. So, back to that smoker. Let's just say someone woke up in the morning and they picked up the pack of cigarettes and slammed it down on the kitchen counter and they said, "That's it. I'm never, ever, ever going to have another cigarette." And then they hear that voice in their head that says, "Well, how are you going to enjoy your coffee this morning without a cigarette?" And it's all they need, and they pick it up. Where, as the hypnotist, you work with the emotional mind, the subconscious mind. And once a thought, idea, suggestion gets in there, it has to take hold. And it's really that simple.
Let me ask you something like erectile dysfunction.
We have to always get into sex.
We have to talk about
You know.
sex. Sex is life.
Right.
Erectile dysfunction. There are many men with erectile dysfunction, and sometimes they will take a pill to overcome the condition, and then they don't take it again. And some people, they just overcome with time. How can hypnotherapy work with?
Yes,
ED?
I've worked with it many, many times. And there's many different reasons. With this, I would make sure it isn't a medical condition.
Right.
So I would definitely need to have your physician referral form.
Right. So
And
that would be my part. Make sure that I do all the work.
That would be your part. And if it's not a physical condition, then emotionally, there's so many reasons. Just one. Words are powerful. And people can be destroyed with a sarcastic remark. And,
Right.
And they don't even realize it. And oftentimes we take care of that.
Mm-hmm.
Well, Dr. Mencia, and of course you brought up a very good point, but you really do, you interview people so carefully, and you do realize what their problem is. And if you want to talk about ED, a lot of it is really physical. It's because enough blood isn't going into their area. So
no, a great number is psychological.
Is that
It's
right?
psychological.
You see.
A great number
No
of
kidding.
ED is psychological. It's not
Yeah.
physical. Everything, all the machinery they are working fine. Thank you very much. It's just psychologically.
That's right.
You start dating somebody and you go to the bedroom, and the bedroom is overwhelming. Lots of light, lots of color, and it might be distracted to the other person, to the partner, or it might be too flat, or there's no playtime. So when it comes to having sex, you need to be patient. It's not like even when you're going to eat your dinner, you want to sit down. It's a ritual you go through. And some people don't see sex as a ritual. They think they're just going to jump like a chicken and walk out. And it doesn't work like that. It's a ritual. People caress each other, go through the arousal. So when you go, before I became an MD, I was a psychologist by training. So even before I write that prescription for a Viagra or a Cialis for my patient, we go through, what is the problem with having sex or getting an erection. Sometimes one of the key questions I ask my patient is, do you wake up with an erection sometimes? And they go, yeah, I do. Then you don't have a problem. That's it. That's your answer. When I hear that, when I do the blood test and everything else, I know everything else is going to come back normal, but just to confirm that medically there is no any other condition like hypothyroidism or anything like that. And I will examine the legs. I want to know if the patient has venous insufficiency. Sometimes if you have venous insufficiency, we take care of that condition. We have Dr. Mai as one of our guests for venous insufficiency. And correcting venous insufficiency, if it's a medical problem, the erection will come right back without medication. But once we have done the assessment for erectile dysfunction, then you need to go to the subconscious. That's when Pamela come in.
So what is the difference, though, in a psychologist and a clinical hypnotist?
Well,
when would you send someone to a psychologist or a psychiatrist?
Psychologists basically will do what the psychiatry will do, which is to interview you and try to find the reasoning behind your condition or what's going on. There are different schools of psychology. You have Freud school of psychology. Sigmund Freud believing in what happened to us in the past will affect our here and now. Andrew Young has a different school of belief. So there are different schools of psychology. But when you go to the psychologist will not prescribe medication. So I would call the psychologist the homeopathic doctor. And the psychiatrist is more the one that will prescribe the medication, but also can do hypnotherapy. Some of them, if trained, they can go into other modality of care.
Let me give you an example of a case, and it's cases I love to work on when someone's been checked out by all kinds of doctors and they can't find the cause. And there was a case where someone had a pain like in her upper chest, and then it would move to her back and feel like almost a knife stabbing in her back. It wouldn't happen every day. It wouldn't happen the same day. For 8 years, she was dealing with this. In one session, we got rid of it. It was a stuffed emotion from childhood. She obviously didn't know this. I didn't know this, but the mind knows where it needs to go to solve a problem. Is everything one session? No, not at all. But it's usually maybe no more than 3. There are exceptions to the rule based on what someone's coming in for. But that's what makes it magical at times, even though it's not magic.
So, Pamela Shenk, let me ask you a question. Do you send someone home with a tape?
Absolutely not. If you send someone home with a tape, I'm removing things from their subconscious mind. If you play the tape, it's going to put it back in.
Very interesting.
And if it was to be a stop smoker, if I gave that person a tape, they would think that it didn't work on a subconscious level. So no.
Okay, well, that's a good, interesting thing. You know, Ina, you're sitting here, and I've just got to put you on here. Here's our beautiful Ina. Ina, tell us about the Stonewater Spa for a moment.
Well, we all know Stonewater Spa is open 7 days a week. On Saturdays, like day to day, we have a full house. We have 3 hairdressers there. We have full department of nails. We just had coming in new products for body treatments from Farm Fresh. Very exciting new treatments, and there is an opportunity for people to use the most wonderful thing in the spa, the Vishu room for your body treatments, and of course massages and facials.
And the salt room.
And the salt chamber, yes, so the salt room that for people, again, talking about the flu, for people who has congestion and they feel stuffed, they can go and have a treatment there, and that will clear your pulmonary conditions.
Right, so we want people to go there, and I'm going to give that phone number. It's 954-561. I got to keep you in this thing here. You're on a cruise. Stay where you are here. So it's, I love this, 954-561-8799.
Yes,
right?
Correct.
Okay.
Yes.
So, Dr. Mencia, we're coming to the end of this wonderful show. Facebook Live. This is so interesting. Okay, so what are you going to do the rest of this day? Give flu shots.
Give flu shot. I'll be at the office seeing patients. People can call.
Wait. Let me tell you about flu shots.
Oh, we have the neurologist today working at the office. We have Dr. Saki, the dentist is working there. We have Dr. Labovian, the dermatologist, is working. This is on a Saturday.
Well, I know.
This is on a
You're
Saturday.
An
We have
amazing
all
person.
the specialists.
The one thing I have to say about
Pam available, so
right.
if you need,
Pam will
just
be
call.
available today. Good.
Just call and we'll be happy to set something up for you.
Just think, for the new year, you could have a whole new life, right? But the flu shot.
Don't come to see Pam as a walk-in. She works on a very set schedule.
Of course.
You had to call and she had to set you up, and she'll give you an hour just to you, and she makes sure that she works with one person at a time. So please do call. It's not a passing by situation.
No, thank you, Pamela, for being on our show today.
We were going to put her on the new AGI center that we are building. It's going to be a drive-through. Just kidding. And Pamela said, I cannot be part of that.
I never know.
If you go through the drive-through, you say, can I take your order? I want a B12. I want a B12. I want a flu shot, and I want Pamela to do my hypnosis.
Okay, well, we thank you very much, and we're off of Facebook Live.
Thank you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.